appreciate that. Hi, Stefan Hartmann here, Iron Direct Primary Care with Dr. Matthew Tinney of Integrative Medicine of Brevard, and we're in part 2 of our lecture on lab reference ranges. We're going to talk about inflammatory markers that we look for routinely.
Yeah.
One of the first ones that comes to mind is the HSCRP. That's a C-reactive protein.
Yeah.
What does this look for? What does it tell us?
It tells a lot about your risk for cardiovascular disease, especially vascular inflammatory issues. It can be related to any number of things. I mean, if I punched him in the arm hard enough, his CRP would go up. But it's really about where it is consistently and what other factors are involved.
Mm-hmm. It can also be elevated in chronic stealth infections and active infections too.
Right. Yeah. It goes up with a lot of things.
A lot of things. But it's not something we want to live with long-term highs. So if this is high, we may look at some more testing, try to figure out, maybe it's in their diet, maybe they're reacting to a food or something.
That's true. And the nice thing about it too is, although it casts a big net, it rules out a lot of things if it's low. If you come back with a CRP of 0.1, less than 1, your chances of having something significantly inflammatory, whether it's cancer, autoimmune, infection, any of that stuff, your likelihood is much lower. Now, I won't tell you what it is if it's high, but at least you got some method to investigate.
Mm-hmm. The next one on the list is ESR, or sedimentation rate. A test that's used all the time, but what does it mean?
Well, the erythrocyte sedimentation rate is essentially how fast a red blood cell will travel through a standardized medium. So the faster that happens, the more that generally infers that there's some generalized inflammatory response. But that can be conditional on a few things too, including your age. I mean, it naturally goes up as you get older, but it's commonly used to track inflammatory diseases like autoimmune, rheumatoid, lupus, things like that.
Mm-hmm. I read somewhere that it was often associated with more gut inflammation too. If you're hitting 20 plus on the ESR, you may have some gut inflammation.
Oh yeah, certainly, yeah, any of that. Actually 70% of your immune system's in your gut, so it would stand to reason that your ESR would go up if you had some gut inflammation. So one of the things we start with is sensitivity testing, food testing, allergy testing, enzyme, stool testing, those kinds of things can be very valuable.
For my patients, I like to see them with an ESR, 1 to maybe 5. That's kind of my cutoff for it.
Yeah, that would be nice. I mean, anything less than 20 is considered basically normal. But yeah, again, you don't want to be at 18. So yeah, I agree with Stefan. You should have the lower the better.
The lower the better. Homocysteine. This is an interesting marker. You run that much?
Constantly, yeah. Homocysteine is one of those frequently overlooked markers because it's sort of tests for a byproduct of folic acid, sort of methylation metabolism. Methylation is important because it serves as a methylator to your epigenes. And I'll spare you the biochemistry, but the DNA has ways of repairing itself. But in order to do that, it has to stop the process of transcription. So with methylation, it's sort of like you're able to work on your car better in the driveway than when you're driving down the road. If things are actively going on, that makes it more difficult to repair. If things can stay still for a minute, then yeah, things are much better. But homocysteine in itself can lead to a number of other problems, including blood clot formation. It's associated with autism in kids, thyroid disease, Alzheimer's, dementia, all kinds of stuff. So, and it's not that hard to fix. Really, you just need to take the right supplements in the right dosing, and most of the time you can straighten it out.
Yeah, acutely it's associated with myocardial infarction when you have a super high homocysteine.
Yeah. So yeah, damage to tissue.
Yeah.
But
good. And yeah, my cutoff for that is I optimally like to see it, 4 to 8.5.
Mm-hmm.
When we're getting to 10, 14 homocysteine, I'm quite worried about long-term risk to the brain, Alzheimer's, dementia, and the heart.
Sure.
Yeah, I'm worried that this patient's going to have a heart attack, stroke, and dementia at some point. So if you see, homocysteine 14, what do you do for a patient?
Well, there's three pathways that you can sort of intervene with. The most common is your folic acid metabolism. So we put people on moderate doses of 5-methyl tetrahydrofolate or 5-MTHF.
Mm-hmm.
You can also use methylcobalamin or methyl B12.
Mm-hmm.
That helps. Two of the other pathways include N-acetylcysteine. You can use 600 milligrams twice a day.
Yep.
Or the S-adenosylmethionine, the SAM-E, the SAM little e, 400 milligrams of that daily. So if you're doing those three things, you're pretty well covered.
I also like the trimethylglycine. This is a classic bodybuilder supplement used to gain muscle, but it's important in reducing the homocysteine.
Okay, I didn't know about that.
Oh yeah, TMG. I'll have them take some of that. It's pretty cheap too.
All right.
1 gram, 5 grams a day. GGT, gamma glutathione. Back in my student rotations in the hospital, when we suspected a patient wasn't telling us the truth about his alcoholism, so we ran the GGT test. So that's how it was used conventionally.
Right.
But how do we like to use GGT?
Well, I like to use it for, your sort of the back door to, assessing how well your liver is able to detox itself. So liver cleanse, inflammation, detoxification. So if the liver is a little bit on the stress side, depending on what it is that's causing that, you can look at GGT. I mean, honestly, hepatitis just means inflammation of the liver, which can happen from any number of things, including alcohol, but infection, trauma, congestion, number of things, fat
on the liver.
So GGT could also be associated with fatty liver disease, early cirrhosis. So yeah, it's an important marker to look at.
Yeah, and if I see this elevated, it may prompt me to do ultrasound of the liver, kind of look at that, put them on a NAC, maybe some glutathione infusions.
Yeah, milk thistle maybe.
Yeah, all of that. LPPLA2. Have you run this much? It's kind of
it comes with the cardio IQ panel sometimes.
Yeah.
But basically, it's a more progressive measure of vascular inflammation. It sort of infers that there may be some plaque that's leaching peroxidase or peroxide. So it's just a more advanced marker for progressive vascular disease.
Yeah, it is. And then, of course, the liver function test, AST and ALT, which comes with every comprehensive metabolic panel we order. I have a cutoff. I like it in the teens. When it's below, 20, 19s, I'm happy with their liver. When it's going upwards of 20, 30, 40, 70, you got some problems.
Yeah, it's a good. Those are good things to do too, and it kind of falls in line with the GGT as far as that goes. So you probably pretty much treat it in a similar way. Most of the time, you can make some pretty good headway with lifestyle changes. If people aren't too far gone.
Yeah, for the most part, it's getting the fat off the abdomen, the visceral fat, the fat on the liver. That's the number one cardiovascular killer, in my opinion, is the fat on their organs. And the liver is probably the easiest way we can assess this because it's a routine lab panel we order all the time.
Well, and not to mention the fact that everything you put in your mouth goes through your liver before it goes anywhere else.
Yeah. So. Good. All right. We'll go on to the next segment will be on nutrients.